And Ghanima, what would you say is the most important thing to support the health of older people?
The most important is to have availability of drugs and equipment and supplies. If we manage to get those things, people can survive well. Because nowadays, sometimes older people can go to hospital, get some of the drugs, some can't get. To those who have children, they can manage to buy for their father or mother. But to some of them, they can't manage to get it.
And what drugs do you think are most important?
Most of the drugs are for NCD drugs and the joint for the joint pains drugs.
How is it affecting them to not have drugs?
Yeah.
How does it affect them to not have drugs?
Due to they have some problems, so many problems, even hypertension or diabetes. Those drugs are very expensive, and they are supposed to take it daily without missing. So not all the older people can manage to can't afford it. So it will be easy and effective way to care for the elders if we will get drugs and supplies and equipments.
What other supplies and equipment are you thinking?
Supplies and equipment, blood pressure machines, diabetes machines to check sugar, and other blood counts and others.
Is that something that you think if you had blood pressure machines, the older person's groups could do testing in the groups? Or do you think at the clinics?
In the clinics, we should have those. But we as Juaza and HelpAge managed to get some of the blood pressure machines, weighing scales, we gave to HB, home-based care providers in the community. And if there is any problems, they check the blood pressure. If it is high, they can call the person from the health unit and come to see the patient if she or he can't manage to go to the hospital. In these districts which we are working with, in 3 districts which we are working with, Central and West districts, A and B districts.
And are there any innovations, any exciting things that you think older persons groups can do for themselves?
The older people's forums, they can do in income generating activities in order to help themselves to get some money to help in other activities.
Okay.
During our outreach activities, we as Juaza, working together with NCD Association, we are going to the villages, to the communities, to check them. And during that activity, we discuss with the Minister of Health. With the Minister of Health, we get drugs, some drugs. Even for 2 days, a patient gets 2 weeks drugs. If they're for drugs for diabetes or hypertension, but it is not so enough. Yeah. If they can manage to get IGA, income generating activities, they can manage even to buy some drugs for their elders in their communities.
So the groups would do it collectively and use the money to pay for who can't afford?
In their group, they have chairperson, secretary, and accountant. So he can manage to use those money. And nowadays, some of the OPF, or older people forums, they come to our office to take letters to make to open the bank accounts.
Okay.
They have some money in their
Okay.
older people forums.